Good morning, dear professors, doctors, and colleagues. My name is Adi Basuki, plastic surgery resident from Universitas Indonesia, Cipto Mangunkusumo Hospital, Jakarta. Today, I would like to present a case series entitled Pre-surgical infant orthopedic appliance in complex craniofacial deformity involving complete cleft lip and palate patients. A case series. So, complex craniofacial deformities such as frontonasal dysplasia and amniotic band syndrome imposes a considerable burden on affected individuals. Surgical intervention remains the most preferred method to repair facial cleft. Unfortunately, complications such as palatal fistula, post-operative scarring still occur. The use of pre-surgical infant orthopedic or PSIO, which is effective to reduce cleft width in the cleft lip and palate patient, is expected to mitigate this unwanted outcome by influencing bone growth directions for a maxillary alveolar approximation and decrease cleft width. We aim to assess the surgical outcome following the corrections and reconstructive surgery of the patient. So from the case presentation, a total 3 patients with complex craniofacial deformity consisted of 2 frontonasal dysplasia patients and 1 amniotic band syndrome patients. All of them are females. The age receiving PSIO are 7 weeks old, 12-week-olds, and 7-week-olds. The use of PSIO until the first surgery at the age of 65 weeks, 35 weeks old, and 34 weeks old. There are clinical appearance before PSIO application. And these are the constriction plate. The constriction plate itself was designed tailored with the patient's need. After PSIO application, the one had cleft width reductions, and then the second patients have cleft width reductions and also nasal dome head increment, and the third patients had a medialization of premaxilla. So this is the facial appearance post-operative of the patient. After the surgery, the first case has a surgical site infection, followed by wound dehiscence. And from the case 2, there is no dehiscence, SSI, hypertrophic scar, or fistula. However, the third case had a palatonasal fistula. So from the discussion, even with the cleft and nasal and premaxilla corrections, surgical complications still happen in our study. One possible reasons contributing to this is that most of the patients in our study had their PSIO placed older than 6 weeks, which is associated with low maternal estrogen. The estrogen itself will increase the hyaluronic acid level, which alter the elasticity of a cartilage, ligament, and connective tissue of the patient. However, the minimal sample size did not allow us to make a precise and valid comments to assess this outcome. So the conclusion of the study is that all of the patients had the cleft width reductions prior to primary labiaplasty, suggesting that the use of PSIO may be beneficial to reduce the cleft width, move the premaxilla backwards, and more centralized position prior to reconstructive surgery. However, similar to other study, the complications still occurred. Thank you.